Good afternoon. I'm Dave Ogorek, and I'm president of the Pennsylvania Academy of Family Physicians. And I want to thank you for joining us on this exclusive Facebook Live event. For the first time in the history of our academy, we're bringing to you live via social media our state legislative agenda for the two-year 2019-2020 Pennsylvania legislative session. An item of note, PAFP members have the opportunity to help us direct this agenda. In the comments section of this video, you will find a link to a survey that will allow you to rank these action items in order of their importance to you. You should have received an email regarding this and can click the link in that email as well. This will aid the Government and Practice Advocacy Commission in the upcoming legislative session as we determine how best to prioritize the state legislative agenda. Also of note, the PAFP specifically focuses in on certain legislative items in key areas. However, we know that many issues that arise throughout the Commonwealth and throughout our Congress are very important to you and certainly welcome any feedback or interest at any time. Before we begin, here are a few interesting facts about the Pennsylvania General Assembly. In the 2017-2018 state legislative session, 3,953 bills were introduced. Over 1,200 of them in the Senate and over 2,500 in the House. Pennsylvania has one of the largest legislatures in the nation, with 203 House members and 50 senators. This past November's election will mean a greater presence of women in both chambers. There are 9 new women in the House seats and 4 in the Senate. Now, let's discuss each of the items on the PAFP's 2019-2020 state legislative agenda. Nurse practitioner independence. Nurse practitioners are an integral, valuable member of the healthcare team, held in the highest regards by family physicians. However, we know that patients are best served when a physician-led, highly coordinated healthcare team provides care. Therefore, the PAFP has opposed legislation that would expand the scope of practice for nurse practitioners to independent practice and eliminate collaborative agreements. Next item is prior authorization reform. Prior authorizations have and continue to be a significantly burdensome activity to family physicians. You told us this last year in the survey where you shared with us a rising number of prior authorizations you were completing, with a significant amount of time and effort that it was taking on your part to use your valuable time to complete this administrative burden. More importantly, these processes result in delays and jeopardize quality care to patients of the Commonwealth. The PAFP supports reforms that would maximize electronic communications for authorization, as well as adverse determinations, and define consistent response times for authorization, rejections, appeals, and external utilization review. Mechanisms to streamline this process to make it easier and to reduce the administrative burden on physicians and the significant impact on patients are important aspects that the PAFP is working towards. Direct primary care authorizing legislation. Direct primary care is a model of care that's increasingly of interest to our members, particularly our resident and student members. It falls outside the bounds of health insurance and really is an emerging option for patients of the Commonwealth with an interest in getting their care through this great model. The PAFP supports legislation that specifies direct primary care agreements are not insurance, and therefore wants to ensure that this model of care is not subject to insurance laws or regulations. The next item is health insurer credentialing reform. We know that delays in credentialing of new physicians or existing physicians changing practices creates undue hardships, most notably on the communities they serve, with delays in initiation of practice, as well as getting our physicians out there into the communities. The PAFP supports legislation that would standardize the credentialing form and set processing standards that would reduce these effects on our communities. The next item is restrictive covenants. We know that the landscape of healthcare is changing both nationally, but particularly within our Commonwealth. With the age of health system consolidations and the changing landscape that creates within our communities across the Commonwealth, The PAFP supports legislation that limits restrictive covenants in healthcare practitioner employment agreements. Certainly, these barriers have caused situations where it has limited access to care for patients in the Commonwealth, and the PAFP wants to support to negate the negative effects of those aspects. The next item is the Buprenorphine Medically Assisted Treatment Act. With the opioid crisis that has been ongoing in our communities for years and rising to escalating proportions with an increased number of overdose-related deaths, access to care for patients suffering from substance use disorder, and notably opioid use disorder, is critical. With efforts within the state to expand office-based opioid treatments within primary care settings, we want to ensure that access could get there, and our concern is that state regulation could significantly jeopardize those access points. Therefore, the PAFP opposes legislation that would require prescribers of buprenorphine to be licensed by the state and pay any state licensing fees. The next item is the PULSE legislation. We've worked closely and collaboratively with the Pennsylvania Medical Society, and the PAFP supports updating and revising the Pennsylvania law to include the codification of the Pennsylvania Orders for Life-Sustaining Treatment, or PULSE, to be used by medical professionals across all healthcare settings for patients who voluntarily wish to execute a PULSE order. While many of you are using the PULSE document in your practices, it's certainly not codified as a document into law at this point in time, and the PULSE legislation would absolutely do that. Finally, our last, but not necessarily least important, and a really valuable component of our legislative agenda is the workplace accommodations for nursing mothers. The PAFP supports legislation that would require employers to provide employees time to express breast milk in a sanitary environment for her nursing child. We know that breastfeeding is best and are supportive of our breastfeeding mothers and want to provide an environment in the workplace to do so. This completes the PAFP's 2019-2020 state legislative agenda. I know we had an opportunity within the Facebook Live event to have some comments or questions received from the audience. So I wanted to take some time now to see if there were any comments or questions that I can address. So seeing none at this point in time, I want to share with you that this agenda is crafted through the Pennsylvania Academy of Family Physicians Government and Practice Advocacy Committee, or GPAC, with position decisions made by the Academy's Board of Directors. We certainly welcome, as I mentioned earlier, any concerns regarding these issues, as well as other issues that may arise within the Commonwealth that are affecting your practice. And you can certainly direct any questions about this agenda, comments, or requests to either myself or to contact Brent Ennis, PAFP Deputy EVP and COO, and State Registered Lobbyist at bennis, E-N-N-I-S, @pafp.com. And as a final reminder, please view the comments section of this video for a link to a survey which will help us prioritize this agenda over the upcoming legislative session. The PAFP thanks you for your support and your membership. We want to work hard for you, and advocacy is one of our big strategic planning points and strategic agenda points to serve you to make your practice better for the citizens of this Commonwealth. Thanks once again for joining us. We at the PAFP wish you a joyful holiday season and a prosperous new year.